Hello, everybody. Thank you all for being here today. My name is Daniel Cohen. I am a sophomore here at Oglethorpe University, and I am also a bio major. Today, I will be discussing comparative pathology, diagnosis, and treatment of prostate cancer in human versus canine models. So, the main reason I chose this as my topic for this presentation is because not only am I a bio major, but I am also on the pre-med track, so this is right up my alley. With me wanting to become a doctor, I am going to have to compare pathology reports, study pathology reports, diagnose people, and treat people with various disorders. So, what's better than to start with now by explaining pathology, diagnosis, and treatment of a certain disease, prostate cancer, in human versus canine models? So, for my outline of my paper, first we will be discussing exactly what is prostate cancer, who does it affect, what are the effects of it, what are the treatment, are there different types of prostate cancer, etc. Next, we will go into why prostate cancer matters to us, then what is exactly the current rate of prostate cancer in America, and then we will dive right into the experimental study that I chose to present to y'all today in this presentation. And lastly, we will go over my take-home messages and my references list. So, exactly what is prostate cancer? Well, prostate cancer is the most frequently diagnosed cancer in individuals in developed countries. More than 1.2 million cancers are diagnosed each year. And basically, just like any other cancer, prostate cancer is just when the cells that are located in the prostate keep dividing over and over and over again and replicating. And as you can tell, just like any other cancer, this can be a huge problem for the people that it affects. As well as what prostate cancer is, there's also several types of prostate cancer and several forms of treatment. But before I get into that, I want you to look at two of the pictures that I have. On the left side, we see the male reproductive tract in a canine dog. And on the right side, we see the male reproductive tract in a human. And as you can tell, just from looking at them, it's very similar to one another. The way they look, and you'll see later on as I explain also in the way they function. The whole purpose of the prostate is to produce some of the fluids found in semen. And we both see that in canine model, which is on the left, versus the male reproductive tract model on the right. So for the several types of prostate cancer, there are multiple types, at least 5. But the most common there are adenocarcinomas, which are split up into acinar and ductal adenocarcinomas. There are urothelial cancers, squamous cell cancers, and small cell prostate cancer. So for acinar adenocarcinoma and ductal adenocarcinoma, these are usually cancers that developed in the gland that line the prostate, or cancers that start in cells that line the ducts or tubules of the prostate. And these types of prostate cancer, adenocarcinoma, are the most common type. Mostly everyone with prostate cancer has this type. And also, ductal adenocarcinoma grows way more rapidly and quicker than acinar adenocarcinoma. But that's just another fact to have. For urothelial cancer, this is cancer that starts in the cells that line the tube carrying urine to the outside of the body. It usually starts in the bladder, but eventually leads and ends up spreading into the prostate. For squamous cell prostate cancer, these are cells and cancers that start from cells that cover the prostate. It's those flat cells. And these grow and spread way quicker than adenocarcinoma cancers. And the last one is small cell prostate cancer. Small cell prostate cancer is made up of small round cells. It is called a neuroendocrine cancer to a lot of people because the neuroendocrine cells that are involved eventually turn into tumors. Also, for the several forms of treatment with all these different types of prostate cancer. While having prostate cancer, there's many conventional forms of treatment. for localized prostate cancer, which include radiation therapy with or without hormonal therapy, brachytherapy, which is a sealed source of radiation that is placed next to the treatment area. There's also radical prostatectomy, which is partial or complete removal of the bladder and or the prostate. And also active surveillance is just another option for treatment of localized disease as well. But in the experimental study that I chose, that I will discuss later on in this presentation, another form of treatment that it explains is by using anti-CCR4 treatment. And this form of treatment uses an anti-cancer chemotherapy drug known as mogamulizumab or piroxicam, which I will get into later on. So exactly why does prostate cancer matter to us? Well, just like any other cancer, cancer is the second leading cause of death in the United States, right behind heart disease. And in this graph, as you can tell, this is the top 10 types of cancer in men. Of course, or the rate of the number of new cases per 100,000 populations per year, based on the ASR, which is just the age standardized rate of a population if we have that age. And as you can see, is prostate cancer is at the top of the list for men. So this is exactly why it does matter to us. Not only is it a form of cancer, which can be detrimental to the body of individuals and patients, but also it is at the top of the list of cancers that, are involved in men. So this is why it really does matter to us. For the current rate of prostate cancer in America, so in humans, about 1 out of 8 men in their lifetime get diagnosed with prostate cancer. In older men, it's usually in older men, 65 to 70 years old, and usually in non-Hispanic black men. But of course, you can get it under the age of 40, 30, but it's just very rare. It's a rare case to see that. Now, compared to humans, in dogs, less than 1% of cancers are diagnosed. So this is a very rare phenomenon. And you might be wondering, why does it even matter looking at dogs if only less than 1% of cancers are diagnosed? Well, the reason is because dogs share, many of the same functional, anatomical, and physiological features of the prostate with humans. So this makes dogs a great model organism when studying prostate cancer in humans and in dogs. And also, on this graph on the right, this figure, this is just showing how you can see from 2019 to 2020, the number of new cases rose, the number of deaths rose, the number of minutes that a man will be diagnosed decreased. So they're getting diagnosed faster as the years go on. So this is also another reason why prostate cancer needs to be diagnosed and treated in individuals that have it. Now to get onto my experimental study. So for my experimental study, I decided to pick a paper that was called, at the bottom you can see right here, it's called Anti-CCR4 Treatment Depletes Regulatory T Cells and Leads to Clinical Activity in a Canine Model of Advanced Prostate Cancer. Yes, that is a very long title, but I promise you I will get through all the difficult words if you don't understand anything in that title, like anti-CCR4 treatment or what are regulatory T cells. But first, for the hypothesis. So for the hypothesis for this experiment, they hypothesized that anti-CCR4 treatment in a canine model shows therapeutic efficacy. So you might be asking yourself, well, what is anti-CCR4 treatment, or what are regulatory T cells? Well, anti-CCR4 treatment uses anti-cancer chemotherapy drugs, like I said in an earlier slide about mogamulizumab and piroxicam. And these are chemotherapy drugs that are an effective agent for a patient's tumor infiltrating regulatory T cells that express this CCR4 gene. And also, regulatory T cells are T cells that have a role in regulating or suppressing other cells in the immune system. So their goal was, if you have regulatory T cells that express this CCR4 gene, and regulatory T cells are in an abundance when somebody has prostate cancer, why not target that gene, that CCR4 gene, and use an anti-CCR4 treatment known as Mogam, Mulizumab, or Piroxicam to, show some therapeutic efficacy. So for the study design, this study, the goal of this experiment was to obtain tissue samples from dogs with prostate cancer, and see the effect that anti-CCR4 treatment had on tissue samples. So it was not a matter of really treating the dog completely by giving it medicine and following up with it every 2 weeks, every 3 weeks, every 4 weeks until, either they eventually lived or they eventually passed away, and see what they could, what that treatment had and what effect it had on the dog. So the goal was not really that. It was just to obtain tissue samples and to see the effect that anti-CCR4 treatment had on those tissue samples. But during the follow-up period, 13 of the 18 dogs died. 12 from progression of advanced prostate cancer, which is common, and 1 from disseminated intravascular coagulation, which is really just a disorder that disrupts blood flow and its blood clotting abilities. But as you can see in this chart right here, the chart is mixed up into age, sex, breed, histology, Braf mutation treatment. So, of course, you see in the age, as I explained earlier, it's usually in dogs that are older, of the older age, 12, 11, 13 years old. Then they go on with sex. Are they male MI or MC? Which MI stands for male intact, or MC, male castrated. Also, the different breeds, the histology, if they have prostate cancer or if they're normal, if they have normal prostate without any cancer in it. And also, which I'll get into later on in the presentation, is if the Braf mutation is mutated or if it's a wild type and it's not mutated. And also, lastly, the form of treatment, either with Piroxicam, which is that anti-CCR4 treatment, or that anti-chemotherapy drug, or if they had radical cystoprostatectomy, which is just, again, partial or removal or complete removal of the bladder and or the prostate. Also with this study, what they did is they used human prostate cancer data sets, and they used these to compare gene expression in canine dogs versus humans. So in this graph and in this figure, or table, this is also showing the age, the sex, the diagnosis, and also the Gleason score, which I will get into. So, of course, again, the age. Usually older individuals, 65, 75 years old, they're all males because prostate cancer only occurs in male individuals and male patients. Also, pathological diagnosis. As I said earlier, adenocarcinoma is the most common type of prostate cancer in individuals. So, it's no surprise to see that individuals who have prostate cancer have this type, adenocarcinoma of the prostate. I don't know if it was ductal adenocarcinoma or acinar, but like I said earlier, mostly everyone with prostate cancer has this type. It is the most common type. Also, to get on with the Gleason score, this is a type of test that typically ranges from 6 to 10. And I'll get into the numbers in just a minute. The 6 or less than 6 out of 10 means that your cancer cells look like normal cells and is likely to grow very slowly. But if your number is above 6, it indicates that those cancer cells do not look like normal cells, and they have the possibility to grow very rapidly and at a very fast rate. So, to get on with my experimental results, there's a lot to go on with this experiment and the results that happened. So, first off, just to explain, here is a pathology report of a normal prostate versus prostate cancer. So, in the normal prostate, it looks completely normal compared to prostate with prostate cancer. You might be wondering, what are these red dots? What really is that? And these are regulatory T cells. And like I said earlier, when you have prostate cancer, when an individual is diagnosed with prostate cancer, the individual usually has a high amount of regulatory T cells that are present in the prostate. because those both correlate and correspond with one another. Also, there's a lot of markers that go along with diagnosing and treating prostate cancer. And a few of these markers I will explain later on in the presentation. But on this slide, the two markers are IL-10 mRNA and TGF-B mRNA. These are immunosuppressive cytokines that are also increased when prostate cancer is present. And I don't want to go too deep into that because it's not that important in this experimental study. But the thing that is important that you want to get away from this slide is that there are a higher amount of regulatory T cells in prostates that have prostate cancer, and also there are a bunch of markers as well when an individual has prostate cancer. And in this case, that is IL-10 mRNA and TGF-B mRNA. Also, on the graph over here on the right, this is just showing overall survival was way, with the high amount of regular T cells was shorter than with low amount of regulatory T cells. So this just suggests that regulatory T cells in the human microenvironment are associated with adverse outcome in dogs with prostate cancer. As we're going on with this slide as well, so what we're getting from this slide is it's showing urinary CCL17 and serum CCL17. So these are also genes that are upregulated in an individual that has prostate cancer. So that's all this graph is showing. These are also markers as well, just like the IL-10 or the TGF-B mRNA gene. These are just upregulated. There's a high amount of CCL17 urinary and in the serum compared to normal. But of course, as you can see here, there was more urinary CCL17 compared to serum CCL17 in the normal versus the prostate cancer data set right here. Also, again, this is just showing normal prostate versus prostate cancer, and the red dots are imitating the amount of regulatory T cells that are present in this prostate with prostate cancer. Also, the interesting thing is when you look down on the right side right here, this is just an immunofluorescent kind of scope of a prostate and what genes and what regulatory T cells are present. So this is showing that CCR4 gene. So in a cancer with prostate cancer, it is showing how much CCR4 gene is present, and also how much of these FOXP3 plus regulatory T cells are, and when you merge them together, how much there is as well. So the goal is if prostate cancer has a high amount of regulatory T cells, and with a high amount of regulatory T cells, there is the presence of that CCR4 gene, then again, we go back to the hypothesis. With using anti-CCR4 treatment, we can deplete these regulatory T cells that are present in individuals with prostate cancer. And like I said in the chart earlier about the Braf mutation, so Braf mutation also correlates just like the CCL17 and the CCR4 gene. It correlates with those tumor-infiltrating regulatory T cells along with these two other gene expressions in canines with prostate cancer. So you might not know what Braf genes are, but Braf genes provide instructions for making proteins that transmits chemical signals from outside the cell to the cell's nucleus. And when these Braf genes are mutated, it is a terrible thing that can happen. When they're mutated, these normal cells end up turning into cancer cells. And this is exactly what is happening with prostate cancer. Is this Braf gene is supposed to provide instructions for making proteins to transmit chemical signals from outside the cell to the cell's nucleus is being mutated, and these normal cells are turning into cancer cells. So this is all what is being explained in panel A, B, and C as well. And it's showing the Braf wild type in all three of these panels, which is with no prostate cancer. And this is also showing with the Braf mutation with prostate cancer. So as you have an increase in the FOXP3 regulatory T cells, the CCR4 gene and the urinary CCL17 gene, as you have an increase in those, you have an increase in that Braf gene mutation. So this is all that this is getting at. It's also just another marker for prostate cancer and for individuals that are diagnosed and need to be treated with prostate cancer. So here is the first slide that we really see data on how using anti-CCR4 treatment depletes regulatory T cells. So as you can see up here, don't get bogged down all with what is on this slide. I will make it as easily to understand as possible, trust me. So this is just showing that in A, that mogamulizumab, which is that anti-CCR4 treatment or that anti-cancer chemotherapy drug, it reduced the amount of regulatory T cells in the FOXP3+, and also the CCR4 regulatory T cells, which is exactly what they hypothesized, that using that anti-CCR4 treatment will deplete regulatory T cells. So also, in panel B right here, in this image that they took, this is showing tumor burden size was decreased. So exactly what do I mean by that? Well, you can tell here how big at baseline this tumor was, but at post-treatment, it decreased in size. It decreased quite a bit compared to baseline versus post-treatment. So this is just showing how tumor burden, which by burden I mean size, mass, number of cancer cells, and even just the number of cancer cells was decreased between baseline versus post-treatment. And then, of course, panel C, D, and E. These are all very related as they all correlate with either using two forms of the anti-cancer chemotherapy drug known as piroxicam and mogamulizumab, or just with using piroxicam alone. So with these three data sets right here, this is showing that dogs treated with both of these anti-CCR4 treatments had a greater reduction in prostate cancer. And we tell that right here. This is showing minimum tumor burden. And with both, it's decreased compared to with just piroxicam alone. So this is very, very good to see. Also, this is showing right here in D that clinical response to both treatments was higher than the response to piroxicam alone. And we see that with both form of treatments, we have a greater partial response, a greater stable disease, and a greater amount of, or a less amount of progressive disease with the disease not getting worse compared to just with, piroxicam alone. And in E right here, this is just showing, again, like I explained in the previous slide, the overall survival and the progression-free survival, which is really just the time before and after treatment that a patient lives with the disease but does not get any worse. And both of these survival rates was longer when treated with both. We see that as here, when treated with both, which is here in green, the survival rate was longer, 600 days. And the same goes for here when treated with both. It was just longer than when treated with piroxicam alone. So with all of that data taken together, this is showing that the adverse events or the effects that the dogs had treated with these anti-CCR4 treatments or the anti-cancer chemotherapy drugs, which are the same thing. This is showing the different type of events or effects that these dogs may have had, and the grade 1 through 5, grade 1, 2, 3 through 5. And the grade 1 through 5 is really just indicating the toxicity grade that these dogs had. And the good thing is, there was only grade 1 through 2. There was no grade 3 through 5 at all. And it's not like there was a low amount of grade 3 through 5, but there was no amount of grade 3 through 5 at all, not even a low amount. It was 0, which is very good. So taken together, these results suggest that with using anti-CCR4 treatment, with using anti-cancer chemotherapy drugs, and with using piroxicam and mogamulizumab, it shows that this treatment depletes regulatory T cells and leads to clinical responses and improves survival rate without severe adverse events in dogs with prostate cancer, which is a very, very, very good result to see in this experiment. And that is exactly what they hypothesized at the beginning. So to conclude my presentation right here in my experimental study, the things I want you to take away from this experimental study is that the CCL17 and the CCR4 gene pathway is also associated and correlated and is another marker with regulatory T cell inflammation or infiltration into tumor tissues in humans and canines. Also, by blocking CCR4, the gene, which is very associated with regulatory T cells infiltration and the high amount of regulatory T cells in prostates with prostate cancer, it leads to improved survival rate without toxicity levels going through the roof, as I explained in the previous slide, as all the adverse events were grade 1 and grade 2 and not grade 3, 4, or 5. Also, by using anti-CCR4 treatment in a canine model, it definitely supports their hypothesis and does prove to show therapeutic efficacy, and it may be a viable process for reduction in regulatory T cells in dogs and some human patients with low toxicity levels. Lastly, what I want you to take home from this entire experiment and from my experimental study that I have explained: cancer is a complex side effect of multicellular organisms. Cancer, we've probably known somebody who has had cancer some type time in their lifetime. So it is bound to happen. Cancer will always be with us. And this is just something that we're going to have to deal with. It's a complex side effect of us, multicellular organisms. And we're going to have to figure out better ways to diagnose people, better ways to treat people, better ways to look at pathology reports and see what we can do to help people out that are diagnosed with prostate cancer, but any other cancer as well. Also, pet dogs and men both have considerable risk for development of prostate cancer. So this goes right on to what I said, how dogs are good model organisms for studying prostate cancer in human patients. Also, canines and men share the same clinical features, either described as late age onset and pattern of cancer growth. By late age onset, I mean canines, dogs, and men both usually get prostate cancer later on in their life. In men, it's 65 to 70 to 75 years old, or even beyond that. And in canine dogs, it's 11 years old, 12 years old, 13 years old. It's late age onset. And for pattern of cancer growth, I mean by the most common and different types of prostate cancer. And as we could tell from both human individual patients and from canine dog patients, we saw that the most common pattern of cancer growth and most common type of prostate cancer was adenocarcinoma, which is what I explained at the beginning, how it is the most common type, and mostly that everyone has prostate cancer has that type. And lastly, just like any other cancer and any other disease or disorder, if prostate cancer is not diagnosed and not treated, we could see cases to steadily keep rising in the future. So this is definitely something that we want to jump on the ball. We want to get diagnosed. We want to be treated so we don't see these cases to steadily keep rising in the future. Lastly, these are my references. I used a variety of references for this presentation, but for my experimental study, I primarily used the top reference, which was anti-CCR4 treatment depletes regulatory T cells and leads to clinical activity in a canine model of advanced prostate cancer. Thank you all for joining me today here in my presentation, and I hope you all have a great, wonderful rest of the day.